the Executive Director of ABOG, and I direct the standards for certification in ob-gyn and our 5 subspecialties. I'm joined today by Dr. Wilma Larson, our Associate Executive Director for Examinations, and Carrie Lapandaka, our Manager of Subspecialty Divisions and External Stakeholder Relations. We're proud to be able to talk to you today to help clarify subspecialty certification standards and examinations during the COVID-19 pandemic emergency response. First, we thank you all for the incredible work you're doing caring for your patients, your colleagues, your families, and the communities in which you serve. You're at the front lines at a crucial time for our country, and your examples and inspiration for us. There are important implications for the changes in practice, education, research, operations, and training that you and your fellows may be facing now and in the next few months. We want you to be assured that your participation in your local COVID-19 response should be your primary priority. ABOG will work with fellows and programs affected by the local crisis to help your fellows complete their training, help you assure that the fellows are competent to practice their subspecialty without supervision, and that they will be eligible to seek ABOG certification. We recently released temporary accommodations to the standards for both ob-gyn and subspecialty certification. In addition, we released a set of frequently asked questions regarding subspecialty certification standards and requirements. We hope to answer additional questions or address any concerns that you have about these policies today. In addition, the ACGME has released statements and guidance regarding fellowship program requirements and accreditation. We will not be commenting on these policies today other than referring to you to those documents posted online on their website. We can assure you that we are in communication with their Executive Director and the Chair of the RRC for ob-gyn frequently to work collaboratively on policy, standards, and accommodations for your programs and fellows. Please feel free to reach out to either the RRC or ABOG staff offices with any questions or concerns about either organization standards that you may have. Unfortunately, as you know, the 2020 certifying examinations for subspecialties, or the CEs, had to be canceled in April, and we are now in the process of establishing an alternate date in the fall to offer the oral examinations. We hope to have an announcement about these dates soon, and Dr. Larson will have some comments about that in just a moment. In addition, we hope to offer the 2020 subspecialty qualifying examinations, or the QEs, in late June as scheduled. Unfortunately, Pearson VUE testing centers are closed through April 30th currently, and we are closely monitoring this situation. Our application data indicate that most fellows have reserved their site of testing for the June 26 examinations already. We'd also like to welcome each of the 5 subspecialty division chairs who are on the call too. Dr. Marlene Corton, Dr. Jean Sheffield, Dr. Corey Schreiber, Dr. Michael Thomas, and Dr. Fidel Valleja are also present for this session. In addition, I'd like to thank Rachel Crawford, Sandra Hodgson, Kurt Diepenbrock, and all their teams at ABOG for setting up the support and technical assistance for this. As you can imagine, this is our first attempt at this, and we really appreciate all the work that they've done. We'll begin the session now by answering some questions submitted in preparation for the meeting. We will then open up the session for your additional questions. In advance, thank you for your participation and commitment to women's healthcare. Wilma, would you like to begin with some comments about the April CE for the subs?
Yes, thank you, George. I just want to let everybody know that since we had to cancel the subspecialty certifying exam, we've been working on a time to reschedule. Our goal was to make sure that we could give examiners and candidates at least ideally 6 months in order to give them time to schedule the ability for examiners to participate and candidates to schedule time away from practice. We are very close to being able to announce the new date. I think that announcement will come out next week. And so please keep keep tuned for that. We will be sending that announcement out to each of the candidates as well as each of the examiners individually. And we really do thank all of you that are on this call that are examiners for the subspecialty for participating in that process. We certainly could not certify our subspecialty, our subspecialists without you.
Dr. Wendell, you're muted.
I'm sorry. I'm going to read one of the first questions that was submitted in preparation for the meeting, and I appreciate this. This is an important one that's been asked several times. We have fellows who are sidelined because of COVID-19. They've already registered for and paid for the oral ob-gyn board exam to be taken this fall or winter. They're worried about not having enough cases for the boards. Will you be extending the case collection deadline for the ob-gyn certifying exam? Wilma, do you want to take that?
Certainly, and thank you for whoever submitted that question or the multiple people that did, because that is obviously a very important issue. We are making a lot of changes and accommodations for the specialty CE that we hope will help every candidate to be able to sit for the exam this year that wants to. So we are extending the application deadline as well as the case list submission deadline. We're changing we're doing away with late fees. We're also changing the minimum criteria for your case lists, and we're increasing ways that you can add cases to the case list that we have not used in the past. All of that will come out in a communication as well as a new revision to the 2020 certifying specialty bulletin. Those will come out hopefully before Friday of this week, if not very early next week. So please look for those changes. We want to do everything we can to make sure that COVID-19 doesn't prevent people from taking the specialty certifying exam that want to.
Great, thank you. Second question is, currently MFM fellows are required to do labor and delivery in a 1-month block. With our fellows having to take 1 or more shifts on L&D during the pandemic, are we able to count that as time towards their required labor and delivery standard? And that's a good question, and we've gotten that several times from other folks, so thank you for bringing that up. The answer is yes. The requirement is to have those in blocks, but for this period, we will allow some flexibility in meeting that requirement. So it can either be in blocks or the equivalent experience, however you're able to craft that together for fellows. The important point is to get some experience in labor and delivery in a supervisory capacity, and if that can be done in another fashion, that will certainly meet that requirement. One thing that we noted in the frequently asked questions was that we had asked for program directors to submit requests for approval for alternative experiences that would meet core clinical requirements. As the pandemic response has evolved, it's become clear that that would create an enormous administrative burden on you to do. So we will be changing how that will be administered, and it will become part of the verification of training statement at the end of training that they either the fellows met those requirements or the equivalent of that through longitudinal experience during their fellowship training, so that you don't have to submit individual requests for exceptions for that. I hope that meets everyone's needs and will be well received and allow you to focus on more pressing issues. There's a third question. And this is in regards to that. With regards to the request for equivalent experience exceptions, what's the best time to make the request? At the beginning of the affected rotation, the end of it, or the end of the academic year? And again, we hope that that's a good question, and we hope that we can relieve the administrative burden on you all by making that part of the verification of training at the end of completion of the fellowship, and we will leave that up to the discretion of the program director and the fellow about how that is met. And we hope that those decisions are made with the best intent, that the fellow is not completing their training with inadequate knowledge, judgment, or skills, and that in the alternate experience, they've acquired the information and the abilities that you had hoped during the alternative equivalent experience. Wilma, do you have the next one? Do you want to read that one? Or I can read it if you don't. If time spent by
I have it. I was
fellows,
just muted.
oh, go ahead.
If time spent by fellows is in mandated COVID-19 quarantine, social distancing, or working from home will be considered clinical experience. Does an equivalent experience exception request need to be made? Thank you for this question. This really goes right along with the ones that Dr. Wendell's been answering. We want to make this as easy on you as possible. There is no need to submit an equivalent experience exception for those reasons. Again, the program directors will attest at the end of the training that the fellow has met the standard that needs to be met.
It may be important to mention here that our comments are regarding ABOG certification eligibility standards, and there may be other requirements that the ACGME makes in their guidance and their comments, and if you are required to notify them of experiential changes and rotations with certain thresholds, please know that you still need to meet those requests. But for us, our comments are regarding your training and your fellows' eligibility for certification. I hope that distinction is not unclear. The next one is, in the event a fellow feels they need to change their thesis project due to the impact of COVID-19 and is uncertain if the new concept will meet ABOG eligibility criteria, can we submit that idea for review? Will there be a rapid turnaround, and to whom should we submit that? That's a great question, and we've gotten that several times too, so thank you for bringing that up. It's clear that there's been a disruption in everything in training, clinical and research is a vital part of our fellowship training. There are projects that are going to be completed on time. There are going to be some that are completed late, and there's some that are going to need to be abandoned and reconsidered. We will do everything we can to turn around our questions, if you have them, about whether a thesis seems like it meets the ABOG eligibility requirements. However, you're not required to submit those before you switch a project. The divisions monitor the thesis project to provide formative feedback to help make sure that fellows are on the right track to completing their research requirement and the thesis for completion of the fellowship and to be eligible for certification. But you're free to turn those around, and if you do submit them to us, we will turn them around rapidly. We will have a lot of flexibility in our criteria about what we'll accept during these unprecedented times. If you do have questions, please email those to fellowship@abog.org, and we will take care of those. Woman, you want to get the next one?
Sure. Do the possible exceptions for extending time to complete research past graduation date and changing thesis topics apply to third years only, or also to first and second years? That's a really great question. Thank you for submitting it. We are hopeful that the majority of the changes that have to be implemented will apply to fellows completing in 2020. That being said, no one knows what's going to happen with COVID-19, how long it's going to last, or how it's going to affect us 6 weeks or 6 months from now. So with that being said, we are planning for flexibility, and the exceptions apply to everyone, we'll be reevaluating everything as we go forward in the future to make sure that we provide the maximum flexibility for people as they deal with the pandemic.
And I hope that answers that question. The last one's an uncomfortable question, but in the unfortunate event that one of the fellows passes away or is permanently incapacitated after COVID-19 infection, would ABOG grant board certification posthumously or to that fellow if they're unable to complete their training and certification? This is clearly an event that we hope doesn't happen, but it may. And we would work with any fellow and any program and any family to help them through this situation. We have had fellows who have had disabilities in the past who have very much wanted to achieve certification, and we've also had fellows that have passed away during training, and we would be happy to make any exception that was requested for a situation like this. Again, I hope this doesn't happen, and if there are any questions, please feel free to contact us. At this point, those were the prepared questions, or there's one more that was submitted just this morning. Currently, the fellows are required to do L&D in a 1-month block. Our fellows are required to do 1 or more shifts in the pandemic. Will we be able to count whatever they do in L&D towards the requirement? And the answer is yes. We will count that, and that would meet the L&D requirement. I think that was very close to one of the other ones asked before. Cariel, are there questions that have been submitted that we can begin to address?
I can read the first one, George.
Sure. Go ahead.
So our first question that's been submitted during the broadcast is, will the written...
Sorry about that, having a hard time with my microphone. The first question we received is probably a good time to address it for people who weren't here right at the very beginning. Will the written subspecialty boards be delayed as well, is the first question.
So I'll take that one, if that's okay. We are really hopeful, as George mentioned, that the the qualifying exams for both subspecialty and specialty will not be delayed. We still have the time booked with Pearson VUE, although they are closed now. Their plan is to open it back up at the end of April. And our hope is that we will be able to give our exams on time. We would ask that anyone who has applied for those not cancel or withdraw at this time, because you can literally cancel right before the exam if you need to without penalty. And if you were to cancel now, then you would lose your seat with Pearson VUE, and it might be very difficult to get it rescheduled if the exam goes on as we hope it will. So our hope is definitely that the written boards will take place at the end of June as scheduled.
This is a very fluid situation and clearly dependent on how the epidemic unfolds across the country. And if it is such that some of the Pearson VUE centers are open, but not all of them, or that all of them remain closed, we will seek an alternative means to offer that test either later this year or allow people to defer it till next year without penalty. I think we can say that we'll be very responsive and accountable to the people needing to take this test, and we'll do our best to make it such that whatever disruption COVID-19 has had on their personal and professional lives, that we can hope that ABOG will be of service to help them move expeditiously forward when they feel prepared to take those exams. The next one I can read says, will this seminar be available for listening to again on the ABOG website? And I'm going to let that one be answered by our communications folks, because I'm going to guess the answer is yes.
Yes, so they're actually not on, but yes,
okay.
This will be available. We'll make sure it's distributed.
It's being recorded, and it will be available clearly this is the first time we've done this, so I have no idea how it's going to happen, but I'm very confident that it'll be out there so that those that couldn't see and hear it today will be able to do so.
The next question is, I'm assuming we can consider March and April as 2 separate 1-month research blocks for fellows who have not been deployed into an alternative clinical assignment to meet ABOG certification requirements.
And the answer to that is yes. Although most of our comments and questions that came in before were about time off and counting towards clinical rotations, it would also count for research rotations too, and to meeting that standard. So we will be revising that policy to expand that, to make that clear to everybody that if you're out because either you're furloughed or you're at home in quarantine or you're social distancing or whatever, if it's due to COVID-19, we will allow you to count it for whatever you need to in order to help your fellows meet the requirements for eligibility for certification. Again, I can't comment on the ACGME requirements, although I think that in general, as long as this doesn't last many months, they will be significantly close to what we say.
Next question is, if an equivalent experience plan is approved by the program director and has been submitted in the verification of training statement, will it count toward the candidate's ability to graduate and sit for boards? And do we need to wait for ABOG to approve the verification of training?
That's an important question, and thanks for answering it. The question is no. We will take your professionalism and your best judgment as the gold standard here. If you think your fellows are ready to complete their training and have met the standards that the ACGME sets, that they're able to practice their subspecialty independently and without supervision, we will have a broad statement about meeting our requirements for certification, that will suffice. And if you don't feel that you can sign that or have questions, please feel free to contact us and we can work with you on that. I hope that's answering the question. It will not require a separate approval. You signing it, in our mind, is the verification that you believe the fellow is competent to practice independently and has met certification requirements.
So the next question is, what should fellows include in their yearly research summary about any impact on their research?
That's a great question. And we were talking about that earlier this week about what to expect in the research summaries. We will probably have to get those submitted on time in July because the divisions are meeting in August and we've already got commitments for those meeting dates. All those may end up changed depending on how things go. I would just say whatever you can submit that is reasonable, please put in there. We are not going to micromanage the progress of the theses this year. Whatever you could do to help the fellows meet the requirements and be ready for eligibility for certification will suffice.
It says, for first-year fellows in research lab, many lab projects will not complete by July 1st when they transition to clinical. Moreover, many labs may not ever open back due to lack of finances. How do fellows submit incomplete projects?
That's a good question. And it's an important one that we've been asked several times now. I would say that it's tough to have spent a year in the lab and not have a project or something that could end up being your thesis. In that regard, I would say the best would be to contact us and see what we can do to help that fellow. Our goal is to not have fellows prolong their training for an event like that, but our other goal is to make sure that they're ready for eligibility for certification. If there's any possibility at all of their participation in other research, we would probably increase our flexibility in what we would allow them to participate in. We have had theses that were submitted in the past that were not as robust or as complete as one had hoped, and people have defended those with some success. I think this is probably something that probably needs to be handled on an individual basis, and I would say if you're in that situation, please contact us and let's work together and see what we can come up with for that fellow.
Our fellow is hoping the subspecialty QE would be delayed, not canceled, to allow her to assist and increase clinic load. She would like to take it in September. Has there been any discussion of delaying the QE for subspecialty boards?
Wilma, do you want to take that?
Sure. So thank you. That's a really good question and an important one. There are some significant issues with splitting our exams or giving the exams at more than one time. And we're hoping, as I mentioned earlier, that the exams will be able to be administered at the end of June as scheduled. We're currently hoping not to have to delay them because then, of course, we'll be competing with other boards that normally have their exams later in the years and trying to schedule times to allow our candidates to take them. So at this time, we're not planning to delay them. We hope not to have to delay them. And that's the current situation.
Again, this is a fluid situation, and it's highly dependent on how the pandemic either continues, grows, or resolves across the country. The information we're getting from candidates is that they, as much as possible, would like to take it in June. And that's our intent to try to offer it then. But if it gets to the point where a considerable number don't feel like they can adequately prepare for the exam, we will be looking into alternatives. One of the challenges is if you offer the same exam several times a year, the people that take it second will have an unfair advantage by hearing from the people that took it first what was the material on it, which challenges a certification organization to make decisions based on those exams. So we will be looking at alternatives that we could be able to put together in the event that there's a good number of people that would rather take the exam later in the year. And I can promise you that we will continue to be in touch with you on that, because I think that is a sentiment that may change as we see how the next few weeks go.
Next question is, if a thesis project is affected by COVID-19, how do we let ABOG know? Do they put an asterisk on the thesis submitted for board certification and describe what happened, or send an email explanation?
I'm not sure we have an answer for that yet. I'm wondering if you're asking about that in the annual report, or this is when they're submitting it for the board examination for the oral exams, either for next year. And we'll have to come up with an answer for that. It's a challenging issue, because if we label someone's thesis as such, it could potentially bias the examiners either pro or against that candidate. It may be that we'll probably have to talk with our divisions about how we would handle that. I can't give you a great answer for that now, but it's a great question, and we will look into that and figure out how to best approach that for the candidates to give them the best chance of being certified. Thanks for bringing that up. That's not something we talked about.
If fellows on research blocks are needed to cover clinical service, extending their clinical coverage to more than 4 hours in the research week, would that be acceptable during the crisis?
I think the answer to that is clearly yes. The priority for everybody across the country is to do whatever is necessary to help take care of patients with COVID-19, or to help others so that they can take care of those patients. So we will waive the requirements and the restrictions on practicing your specialty or other essential non-OB-GYN clinical practice during this time.
Will MOC be deferred for oral board candidates this year?
That's a good question. Actually, anybody who passes their boards gets MOC the next year free. That's an ABOG gift to them for all the work to enter into the voluntary process of certification, and then to continue hopefully with us as your continuing certification partner for the rest of your career. Dr. Sue Raymond has announced several accommodations that are rolling out for MOC to reduce the administrative burden on folks during this temporary months of response. So we've tried to make MOC easier for people to meet going forward. And our hope is that these accommodations will be sufficient in most settings. Our goal is that nobody should lose their certification because they're unable to meet MOC requirements due to professional or personal extenuating circumstances due to COVID-19. So I would say if we're working on that and continuing to do that on an ongoing basis. Some of the things she's going to be implementing is incentivizing some of the articles this year so that we will be able to double count reading an article and answering the questions, which will in essence reduce the amount of work you have to do to meet the Part 2 requirement. We've also extended some other deadlines for the MOC exams and reentry exams that typically don't affect subspecialists, but Sue Raymond and her team are working on those kinds of things on a daily basis. And again, if there are unique individual situations, please just call us and we'll be happy to talk to you.
The next question is, programs will have lower procedure numbers than normal. How do we indicate that in our annual report or in the individual fellows numbers?
That's a great question. The ACGME has sent out some guidance on their case log tracking of procedures and the entry of procedures by trainees, and it's important that our annual report of the fellows is an estimate of their experience, and I would just say to continue to estimate as best you can. Clearly this year will be an anomaly, and the next fellows in the next year and the following year may have a lower than expected clinical experience, and that's something we'll just have to follow.
Does the pandemic experience change your opinion about requiring 12 one-month research blocks during fellowship rather than incorporating research into the daily work week, similar to what a fellow's experience might be as a junior and/or senior faculty? In many fellowship directors' opinions, surgical subspecialties increasingly require more than 24 months of clinical activity to develop competencies and surgical skill sets for graduation as an independent subspecialist.
That's a great question, and it's an important one. I think one of the things we've talked about is that this experience has shown us the fragility of a complex fellowship program and requirements that involve both clinical and research requirements. This would be certainly something to bring up at our division meetings this summer. It is a challenge on a variety of levels to do scheduling and to be able to set standards that will help programs know how to get funding for positions, allow the ACGME to monitor program compliance with standards, and allow fellows ample clinical and research time to meet the goals and standards for certification. This is an issue that's brought up almost every year at our our subspecialty divisions, and the board has felt strongly that the block diagram, if you will, or the block model is the most appropriate one. But certainly, again, this issue has brought to bear that having a model like that on some levels makes things very efficient and easily understood and easy for scheduling. On other fronts, it makes it complex when there are aberrations and disruptions like this. So is this going to make us think about this? The answer is yes, and we'll talk about it, but I don't know at this point that there's any movement to make any changes.
Will this verification be for just this year's graduating fellows, or will this include the first and second year fellows?
It's a good question. I think it'll probably be something that we will probably be changing our verification of training to allow this for the next 2 years. We haven't really, we're going day by day and month by month right now. But I think probably if it applies to the graduates for the next 2 years, the language will be flexible and in the verification and how we interpret the standards for the next 2 years. It's a good point.
There are two similar questions in a row here, so I'm going to ask them as one. Will the ABOG annual report deadline still be July 15th?
That's a great question. We talked about that. I would say that as I said before, as the division meetings are already scheduled for August, the deadline will probably remain the same. If you are unable to submit the information and can't meet that deadline, then I would just tell us that when you submit it, and we'll deal with that you don't have full information or you're unable to meet it due to operational issues and challenges within your department and your program. Again, our goal is to help you through this, not make things worse, and we don't want to create an emergency where you're scrambling for data that nobody can get you because they're taking care of more pressing issues. So we'll be very lenient about the annual reports this year.
I'm only seeing one more question on here. Just a quick reminder, if anybody has any more questions, if you'll type them into the Q&A button at the bottom of your screen. The last question I see is, have the MOC articles already been posted on the ABOG website?
The answer is yes, that many of the articles are already out. The January release is out. There are some MOC articles in there. Our SMEs, both in the subspecialties and in general ob-gyn, are writing articles now. The May articles will be released within a very short period of time. They're going through the final steps of editing and being loaded into the computer. As you can imagine, we are very much an office-based organization, and our question loader is physically part of the network on site here and is going to be replaced in the next few months with some IT enhancements. But for right now, the item loader is here, and people have to come in and enter those questions after they're submitted by your colleagues on a division. So we are working as hard as we can to get those ready and out so that you'll have those in very short order.
That's all the questions that we have right now. Is there anything else either of you want to add?
I was just going to ask if we could open up the unmute our division directors in case any of them would like to make any comments.
They are able to unmute themselves.
Okay. Any of you have any questions or comments to add that are specific to your subspecialties that we didn't address or that you'd like to highlight or clarify?
Dr. Thomas, I apologize, you're cutting out.
Hear me now? Hear me now?
Not really.
Oh, sorry. just a statement, just that if you can hear me hopefully, that if anyone has any questions about their research endeavors for their fellows, please give the division directors an email or call.
I would say one of the important things during crisis management is to have a central communication pathway and a consistent message. So it's important that if you have individual situations regarding individual fellows, to please contact us at fellowships@abog.org, so that we will then contact the division director or the division chair and the division if necessary to get an answer for you. If it's an administrative issue, we can handle those centrally, and then we'll be able to populate that fellow's records with that question and exception or accommodation, so that you don't have to worry about that going forward. You're free to contact the division chairs, but I would urge you to please contact us and let us contact them rather than the other way around, so that we'll have a record of it rather than trying to recreate a conversation that you may have had with someone that we don't have a record of. Any other comments? Dr. Valea, Dr. Sheffield, Dr. Schreiber, Dr. Corton?
Just to say thank you. It's Corey.
Fidel or Jean, anything to add?
I don't, George. Thank you. I thought it was well covered.
Great. Dr. Larson, anything to close?
No, we appreciate all of the fellowship directors' time and willingness to participate in this today. We hope we've answered your questions, and if you have any additional questions, please don't hesitate to reach out to us, fellowships@abog.org, or if you have specific exam questions, exams@abog.org. We're definitely happy to work with you to try to make this as smooth as possible.
And if fellows have individual issues, please have them contact us, and it would be good if they copied you on the emails so that we can make sure everybody's in the loop on the discussions and requests. Our goal is to be of service to you and your trainees, to help everybody complete their training on time as much as possible. And if you make a decision to have somebody extend their training, we look forward to working with you and them to help make sure that that can be completed so they can meet eligibility requirements in the best way possible. I would just say one thing in closing. There has been a question that I just got submitted about the announcement on one of the PD group calls that there was a request to move the start date for fellowships from any time between July 7th and the 15th. All I can say is that has not been publicly released by that organization, and that discussion may have been a bit premature. And I don't have much else to say about that. It is important, you know, you can start your fellowships on any day you want. The day you start determines the day they end in the great majority of cases. In our fellowships, it's either going to be 2 years or 3 years later. I anticipate the next time we have a conference call, it's going to be about people can't get there to start their fellowships by July 1st. What does that mean for our training programs? And as you begin to have those discussions, we'd appreciate you letting us know so we can be prepared to come up with a reasonable accommodation for folks. If you're going to start training late due to COVID-19, we would hope that we could make an accommodation and exception so that that would not prolong training for somebody about to start a fellowship. But there may be some important nuances about whether they're actually starting their fellowship then, or it's just a delay to later in the month that we would appreciate hearing about, so we can help make a reasonable accommodation for folks going forward. And with that, I want to thank everybody for your time and attention to this. Has been a really productive time for us to get some feedback about how things are going. If we left things out, please feel free to contact us. If we got something wrong, which I'm going to guess we will, because things are going to change, please contact us too. For your colleagues who are unable to make this, it will be recorded and it will be available on our website in the near future. And I hope that this met some of your needs and addressed some of your concerns. So thank you very much, and be safe and have a good afternoon.